So part of this edition of the AFP article, there was a really interesting close-up article called Caring Better for Patients Who Are Blind or Visually Impaired. So I brought on Bryan, who is an educator for people with visual impairment, and just have a discussion on what he thought about the article and whether he had any tips for us as primary care providers. So the article kind of went through from the perspective of a patient who is visually impaired, and she runs into a lot of pet peeves while she was at the doctor's office, including one of the staff members trying to pet her seeing eye dog, and also, really focusing on her impairment and really not treating her like a normal patient.
So the article is really good. It covers a lot of the really basic things for working with an individual with visual impairments. I wanted to expound on some stuff like the touching of the guide dog. While it seems like it's this really cute little dog that just needs to be pet because it looks so adorable, the average guide dog from a reputable school has about $40,000 to $50,000 worth of training and genetic work put into it. So when they have the big leather harness on, you really don't want to pet them because the dog is working. The dog starts to care more about getting pet than making sure they don't walk into the street.
Okay, so do not pet the seeing eye dog people.
Well, one of the important things is to ask what their system is for labeling.
You mean like labeling medications?
Medications, and also it's always good to check in with nutrition.
Okay.
Individuals with visual impairments do tend to be a little bit more on the plus side and not get as much exercise. Checking with them how they handle their labeling for medications and food. The article mentions 3 rubber bands for medication taken 3 times a day.
Is that so when they put the rubber band 3 times around the bottle to know that that's a TID medication?
TID.
3 times a day?
Yes. It could be that, or every blind person has a different system. They also have high-tech systems now with Walgreens that puts barcodes on their medication.
What about the physical exam part of the encounter? Do you have any tips on how we can make that less awkward or more comfortable?
So the main thing to keep in mind is that individuals with visual impairments can't pick up the information that you and I do with our vision. So there's a lot of incidental learning that happens. So something to keep in mind is just giving them auditory feedback for what's going on. Say if you're just clicking away, entering their information on the computer, a person with sight can just look over and see, oh, you're typing in my information. A person with visual impairments can assume that, for all they know, you're just writing a random email. And when it comes to the physical exam, any tools that you're using on them, let them know what's coming. Maybe even if it's possible, let them physically check it out, hold it in their hands a little bit, like a speculum. Most women and females kind of have an idea of what a speculum is, what it looks like, what it does. Person with visual impairments might know that this thing called the speculum exists. They don't know what it's like, they don't really understand everything about it, but if they can get a chance to put their hands on it, they'll have a much more thorough understanding of it, and it just makes this exam less of a series of surprises.
Okay, great. Thank you so much for your tips, Bryan.
No problem.
Bye.